Dexycu is a novel intracameral corticosteroid that eliminates the need for most patients to receive topical drops. Insertion is very important, and the goal is to get the Dexycu behind the iris. And the traditional technique involves putting the cannula directly in 180 degrees away and having it stay behind the iris, like this case. However, in the FDA trials and in clinical practice, we found very commonly that when you enter 180 degrees away and pull back, that the Dexycu will end up being in the anterior chamber. Now, this is common and not a problem, but optimally you'd like to have the Dexycu stay behind the iris. So we've developed a very simple technique, and the very important concepts are here. First of all, hydrate your main wound so that the wound doesn't leak. Wound leakage is a significant problem because when the wound leaks, it draws the Dexycu out of the eye. Make sure the viscoelastic is removed. Now, we use intracameral moxifloxacin, and we inject the moxifloxacin as the second to last procedure, and then we put the Dexycu in the eye as the final event. We're putting the Dexycu in not 180 degrees apart, but maybe 120 degrees away, and then we rub it tangentially towards the inferior iris, finding that when the Dexycu rubs against the back of the iris, it will stay behind the iris. So again, the same technique. First of all, hydrate the wound, make sure the wound doesn't leak, otherwise it will draw the Dexycu out, and then inject moxifloxacin into the anterior chamber as you traditionally will. Here you see the moxifloxacin being injected, and then insert the Dexycu cannula. Don't go 180 degrees away, go about 120 degrees away, and then inject the Dexycu, and then rub it tangentially against the iris. And here you see actually 2 Dexycu bubbles. And in this technique, the Dexycu stays behind the iris almost all the time.